going to come into the room. I'm going to perform hand hygiene. I'm going to put gloves on. I'm going to assess the room for safety. I'm also going to assess for any IVs or any kind of catheter or anything that might be hooked up to the patient. I'm going to make sure all the emergency equipment is there. I am then going to introduce myself. My name is Stacy. I'm your student nurse today. I'm going to be doing a head-to-toe assessment. We're going to focus on your abdomen because you had an appendectomy. So that will be the first area I go over, and then I'll do the rest of your body after that. Is that okay?
Yes.
Perfect. All right. So I'm just going to put your bed up so that I can reach you more sufficiently. Is that all right? And now, go ahead and tell me what your first and last name is. Oh, what's your first and last name?
Incy, last name PNG.
Okay, and then your birthday?
August 21st, 1994.
Perfect. All right, so the first thing I'm going to do is your vital signs. So I've completed her vital signs. The next thing I'm going to do is assess your abdomen. Now, can you tell me how's your abdomen feeling? I'm going to lift your shirt. I'm just going to do this so I remember that it's lifted. Perfect. And I'm going to assess her abdomen with her shirt up and the blanket pulled up. And I'm going to look at the incisions. I'm going to see if it's descended. I'm going to check to make sure that there's no redness or swelling or heat coming off of the incisions. Everything looks okay, like there's no signs of infection. The next thing I'm going to do is listen. Can you tell me when the last time you had a bowel movement was? Have you had one since the procedure?
Oh yeah, this morning.
Okay, perfect. And then are you passing gas as well?
Mm-hmm.
Awesome. So I'm just gonna listen. And when I put my stethoscope down here by the incisions, I'm gonna just lightly press, not on top of the incisions. All right, everything sounds good. Is it okay if I just lightly palpate certain parts of your stomach? All right, and I'm just gonna lightly press, not to press on her incisions, just around other areas to make sure I don't feel any masses. Everything looks good for that. The next thing I'm gonna do is I'm going to assess her head and neck. I just want to check to make sure that you don't have any sores or anything in the back of your head, no hair loss. I'm going to be assessing her skin to make sure that it is dry and pink and warm. And then I am going to, have you had any ringing in the ears or anything like that? Headaches, anything like that? Okay. All right, so the next thing I'm going to do is I'm going to check your eyes and things like that. Can you take your glasses off for me?
Yes.
Perfect. All right, I'm just going to check, and I see they're at 3 centimeters and they are equal and rounded. I'm going to go ahead and do a check. So, all right. Okay, so they look like they are reacting briskly. I'm going to see if she can accommodate. Just watch the pen for me. Awesome. Okay. Now, I'm going to go ahead and just check in your ears. Thank you. And then can you open your mouth for me? All right, and all her membranes in her mouth look good. Just gonna check her nose to make sure those membranes don't look inflamed. Everything looks good. Can I get you to lift your neck for me, for your head? Just kind of look up at the ceiling for me. I'm just checking to make sure there's no deviation in her trachea. Can you turn towards me, your head towards me? I'm just checking for JVDs. Those look fine. I'm also going to, the next thing I'm going to do is I'm going to look I'm going to ask you a couple questions. They might seem weird. I'm going to have you do a couple tasks for me if that's okay. All right. So can you tell me what the month and year is?
March 2025.
And then can you tell me where you are?
Grossman College.
Great. And then what are you doing at Grossman College?
Annual check.
Perfect. All right. So I'm going to have you raise your eyebrows together. I am going to have you smile and frown and then stick your tongue out for me. Perfect. Blow out your cheeks. Very nice. Everything is symmetrical on your face, which is good. She is alert and awake ×4. Have you had any memory loss or anything like that? Okay, perfect. Not since the procedure or anything, right? Awesome. All right, so the next thing that I am going to do is I am going to check your lungs. Is it okay if I touch you? Perfect. I just want to check to make sure your skin is reactive. So it looks good, you're not dehydrated. Or it doesn't look like you're dehydrated. I am going to listen to your lungs, and I'm going to do that by listening mid-clavicular line, in between the inner second costal. Go ahead and take a deep breath for me. Okay, breathe out. Very nice. I'm going to do the other side. Breathe in. All right, so go ahead and breathe in. Very nice. And then breathe in one more time. All right, and then this side. All right. Great. So now I'm going to have you go ahead and turn to your side. So because of your abdomen, we're going to have you log roll. Put your knees up and then pull with your body. Perfect. All right, so I'm going to go to the 5th or the 10th rib. And I'm going to listen. Go ahead and breathe in and out. Very nice. Other side. Breathe in and out. All right. One more time. All right. Now we're going to do the other side. Go ahead. Okay. So then we're going to go mid scapula, in between the scapula and the spine. Go ahead. Breathe in. And breathe in again on the other side. All right. We're going to go just above the apex of the scapula. Breathe in one more time. Awesome. And then one more time. Again, thank you. And now, while she's turned, I'm going to go ahead and do a check of her skin on her back to make sure that she's not moist, extra moisture, and I'm going to make sure that I don't see any sores. I'm also going to check to make sure really quickly to see if she has any hemorrhoids. We don't want her bearing down really hard while she has incisions that need to heal. She could burst them. So go ahead and pull back. Great job. All right. And have you had any shortness of breath, or have you no shortness of breath? Perfect. Okay, so the next thing I'm going to do is I am going to check your heart. Have you had any palpitations? That's kind of mean. It feels like it's fluttering. Have you had any felt like your heart was racing? Anything like that? Oh, good. So let me go ahead and listen to your heart. We're going to listen in the second intercostal. Atrial space. And now we're going to listen on the other side. Down to nerves point. And then we're going to listen to, and then we're going to listen for 60 seconds to make sure that her heartbeats are regular. So after our 60 seconds at the apical pulse, we are going to note that, I'm going to note that there is just S1 and S2 rhythm. You have a regular heartbeat. I don't hear any murmurs. Then I'm going to assess your, can you tell me about how peeing is going?
Yeah,
Are you
normal.
having any burning in your pee? Do you feel like you're emptying your bladder all the way? Yeah? You're not having any trouble holding it or anything like that if you need to get to the restroom? Perfect. All right, wonderful. I am going to check your extremities. Can you tell me if you have any tingling or numbness in your fingers? No? All right, I'm going to put my hands on you just to feel your arms. I'm just checking to make sure she's pink, dry, and warm. Did that hurt? Do you have any pain when I do that? Wonderful. Okay, so the next thing I'm going to do is I'm going to check her her radial pulses to make sure that they're even. Let's see if I can do this better that way. All right, so they're symmetric. So she has bilateral pulses +2 on her extremities. The next thing I'm going to have you do is lift your arms for me. I want you to go ahead and try to push my arms up. Push your arms up with my, push my hands up towards the ceiling. Great. And now I'm going to have you push down. All right. And then I'm going to have you grasp at the same time. Okay. Perfect. And then let me see your fingers. I just wanted to assess, make sure that she has good cap refill. Cap refill is less than a second. So that's good. The next thing I'm going to check are your feet and legs, if that's okay.
Yeah.
So I'm going to pull up the blanket if she has one on. I'm going to assess, I'm going to go ahead and put my hands on. I'm going to assess to make sure that her legs are also dry, warm, and pink. Do you have any pain, tingling, or numbness in your feet? When I touch them, it doesn't hurt, nothing hurts? Okay, so I'm going to go ahead and lift your leg. I just want to check underneath. I want to check her bony prominences to make sure there's no sores. I'm going to do the same to the other. Very nice. All right, I'm going to remove her socks. And now that I've removed her socks, I am going to I'm going to feel for her pulse. Her dorsal pulse, and then her posterior tibial, and both of them are bilateral +2. I'm gonna also look for cap refill on her toes. Have you had any trouble walking? Anything like that? Do you haven't felt dizzy when you go to stand up or when you go to walk? Everything
Pretty good,
seems
yeah.
normal. Perfect. All right. So tell me, what kind of support do you have at home? Do you have family? Do you live with your parents, husband,
My
wife?
husband and kids.
Okay. Wonderful. And are they going to come see you?
Yes.
Wonderful. Perfect. And they'll be the ones that you're going home with?
Yeah.
Awesome. Okay. Well, I'm excited to meet them. Thank you. Here's your call light. Let me know if you need anything. And do you want to tell me about your pain?
2.
Okay. Is on a scale of 1 to 10, it's a 2. Wonderful. And then, so can you tell me what kind of pain you're experiencing?
Just
In 2 words, is it achy? Is it sharp?
not sure. It's just a kind of dull,
Dull and achy?
kind of the incision.
Oh,
yeah.
at the incisions.
Yeah.
Perfect. All right. Wonderful. All right. So let me know if you need anything, okay? I'm going to put her bed back down.